The date is Tuesday, March 9. This is the news on PBCJ. I'm Simone Absalom. It's here. 50,000 doses of AstraZeneca vaccines arrived in the country on Monday, a gift from the Indian government. Jamaicans will begin to receive their first jabs tomorrow, March 10. As was reported last week, frontline medical and health workers are first in queue to receive their shots. Permanent Secretary in the Ministry of Health and Wellness, Dunstan Bryan, says healthcare workers are first priority. He gave this update during a virtual press conference held at Jamaica House on Monday. The government has budgeted for 4 million doses of COVID-19 vaccines through 5 facilities. Permanent Secretary in the Ministry of Health and Wellness, Dunstan Bryan, says plans continue to shift.
We have now received the 50,000 in week 2 and not week 1. But as the Prime Minister pointed out, the plans continue to shift. Some efficiency gains, some efficiency losses as we go from week to week. So now we have our 50,000 in week 2, and we will have our 14,000 in week 3. We still have an anticipation for a private sector source to provide 100,000 by week 4, and we still anticipate that in April we will have 600,000 vaccines, and in May an additional 210,000 vaccines.
He says 4 groups are down to get their first dose of the AstraZeneca vaccine this month.
We start with our healthcare workers, and in March we will also provide approximately 25,000 elderly in infirmaries, elderly in homes, and other persons who are deemed in that 60 and over age group that can access our vaccination program in March. And the Jamaica Defense Force and Jamaica Constabulary Force.
Mr. Bryan says other uniformed groups and educators will get their first jabs in April, and the second dose will be administered in May and June. 17,050 are expected to be vaccinated in the first week.
11,430 healthcare workers, but in week 2 we now will also be inoculating persons from the JDF and the JCF. And then in week 3, we continue the inoculation of healthcare workers, the JDF, the JCF, and then we begin to introduce the elderly population in week 3.
Mr. Bryan says vaccination will be done at health centers and hospitals within the regional authorities. Prime Minister Andrew Holness is warning Jamaicans that the country is at what he describes as a trigger line, and this is the closest it has ever been to going into lockdown since the COVID-19 pandemic shut down the country in March 2020. According to the Ministry of Health, based on the now 32.6% infection rates, 4 in every 10 Jamaican people are carrying the virus. He explained the severity of the situation during a virtual press conference on Monday. Jamaica recorded its highest number of new COVID-19 cases over the weekend, 878 on Sunday, 527 cases on Saturday, and 723 new cases on Friday. Prime Minister Andrew Holness says the numbers show that the situation is serious.
This is very serious. We are now in the danger zone. And what is happening is that by virtue of our past success, by virtue of delaying this point for more than a year since the pandemic, there are those who believe that we have passed the worst. Yes, we are in the darkest hour of the pandemic. And yes, it will pass at some time. But exactly how that happens depends on how you, as an individual, as a citizen, as a worker, as a mother, father, you as the individual. It depends on what you do.
He notes the high number of people being hospitalized due to complications related to COVID-19. Mr. Holness says the availability of beds at hospitals remain a trigger line for the government's management of the pandemic.
In the early stages of the pandemic, we acted on the trigger of the number of cases. You would recall when we put up that trigger line, when we just started to do the controlled re-entry. You will recall that when we decided to put in some of the quarantine measures in communities, for example, in St. Thomas and in St. Mary, we looked at the positivity rate. Now we are at that very critical trigger line, and that is the number of beds. Because this trigger line is directly linked to the mortality rate. If people can't get treated in hospitals, and obviously if you have to go to the hospital, it is because you have dire symptoms, it is likely that you could have a fatal event as a result of the lack of hospital space. So your need to party and be free and go about not wearing your mask has to be balanced against the need of someone who will be deprived of care because we simply have no beds.
The Prime Minister says his administration has done all it can to safely steer the country through the pandemic, and it remains committed to saving lives with even more safety protocols.
If we do not get these numbers down, it is likely that the mortality rate could also rise. So, in this phase of the management of the pandemic, the government has to remain strident. It has to remain resolute in the measures that we have implemented. And I wish to prepare the Jamaican people that if the numbers do not improve, then, as I had said earlier, there are other measures which we will put in place. These measures will have an impact on the economy. It will have even greater impact on your ability to move. It will have even greater impact on your ability to gather. It really depends on what you do at this point in time.
Prime Minister Holness, along with Minister of Health and Wellness, Dr. Christopher Tufton, and Minister of Foreign Affairs, Kamina Johnson-Smith, were on hand to receive Jamaica's first tranche of COVID-19 vaccines on Monday. This first phase of vaccinations is being offered to frontline health workers, the security forces, and vulnerable groups. Here is a look at the latest daily COVID-19 summary.
In the clinical summary for Monday, March 8, 561 new COVID-19 cases were reported. The overall case count now stands at 27,465. 6 new COVID-19 deaths were also reported, pushing the island's death toll to 460. Here now is the parish breakdown. Kingston and St. Andrew reported 169 cases, with St. Catherine having 103 and St. Anne 46. In St. Elizabeth, there were 45 cases, while both St. James and Trelawney had 39. 24 positives were reported in Manchester and St. Thomas. There were 19 in Westmoreland, 18 in Clarendon, and 16 in Portland. 10 cases were reported in Hanover and 9 in St. Mary. 147 recoveries have been reported over the past 24 hours, with that tally now at 14,595. At this time, there are 301 hospitalizations. 29 patients are showing moderate symptoms and 29 are critical. Melvin Pennant, PBCJ News.
Senior World Health Organization official Dr. Michael Ryan is against proposed so-called vaccine passports for COVID-19 for international travel. Speaking at a recent press briefing, Dr. Ryan says the use of such document would cause numerous concerns, including ethical considerations that coronavirus vaccines are not easily available globally.
At the present time, the use of certification of vaccination as a requirement for travel is not advised because, quite simply, vaccination is just not available enough around the world, and is not available certainly on an equitable basis. The measurement of vaccination status is a very important part of normal public health service delivery, and maybe Kate will speak in Sumia to how a digital certification of vaccination, starting with COVID, could be a real addition to our public health architecture down the line. But if we could separate the digitalisation of certification, which I think is a very positive development, and we have a team working in-house on that, and again, Kate and Sumia may update on that, from what is the issue regarding policies around vaccination and what you're allowed to do when you're vaccinated or when you're not vaccinated. Countries, that will have implications for national policy and for international travel and the right to travel down the line. But I think there are real practical and ethical considerations as well that countries will have to address. Because if access to vaccine is inequitous, then inequity and unfairness can be further branded into the system if we continue to make decisions on what people can and can't do, where they can and can't go, on the basis of being vaccinated, when being vaccinated itself is not something that everyone has equal access to. And there are also people who, for whatever reason, cannot be vaccinated or do not wish to be vaccinated.
The national 2021-2022 budget debates begins today, March 9, with Minister of Finance and the Public Service, Dr. Nigel Clark. He will give the opening address at Gordon House. On February 18, following the annual ceremonial opening of Parliament, Dr. Clark tabled the 2021-2022 estimates of expenditure, revealing $830.8 billion in expenditure and total revenues projected for the fiscal year, which begins on April 1. You can watch the budget debates live on PBCJ and all its social media platforms. Opposition spokesman on finance, planning and the public service, Mr. Julian Robinson, will speak on March 11. Leader of the opposition, Mr. Mark Golding, will speak on March 16. Prime Minister Andrew Holness will deliver his address to the House on March 18. And Minister of Finance and the Public Service, Dr. Nigel Clark, will close the debate on March 23. Former PetroJam chairman Dr. Perceval Bahado-Singh was arrested and charged on Monday on 12 counts of obtaining money by means of false pretense. The major organized crime and anti-corruption agency, MOCA, announced the arrest in a release. Between December 2016 and May 2018, it is alleged that Bahado-Singh fraudulently claimed several reimbursements and was paid monies by PetroJam for overseas business trips that he did not attend. The false claims over the period amounted to $73,620, according to MOCA. The agency says it put together a multi-jurisdictional probe and finalized and submitted a file to the Director of Public Prosecution, who gave the green light for criminal charges to be filed. Following his arrest, Dr. Bahado-Singh was offered bail and is to appear in the Kingston and St. Andrew Parish Court on Wednesday, March 17, 2021. Bahado-Singh resigned as PetroJam chairman in 2018 as the entity was embroiled in a corruption scandal that led to the resignation of the then Science and Technology Minister, Dr. Andrew Wheatley. MOCA says it will be continuing other investigations into the PetroJam matter. A woman is dead and 31 persons are homeless after a fire destroyed their home on Beeston Street in downtown Kingston before dawn on Monday. The dead woman has been identified as 37-year-old Latoya White, a vendor who does business at North Parade. Reports are that the fire started in one apartment on the tenement and it quickly spread and caught the remaining buildings on the premises. District Officer for the York Park Fire Station, Sandy Straw Dawson, says the fire department received a call at 3:45 a.m. and came to the scene to perform cooling down operations. The cause of the fire is still unknown. Gabriel Thompson gives us a quick market breakdown in this business report.
In Monday's trading session, the JSE combined index advanced by 116 points to close at just under 400,000 units. Overall, market activity resulted from trading in 87 stocks, of which 43 advanced, 35 declined, and 9 traded firm. The junior market index advanced by 2 points to close at under 3,000 units. Stocks advanced for 138 Student Living Jamaica, 1834 Investments Limited, and AMG Packaging and Paper Company Limited. Stocks declined for Caribbean Cement Company, Caribbean Producers Jamaica Limited, and Siboney Group Limited. Trading firm were CAC 2000 9.5% preference shares, Elite Diagnostic Limited and Epley Limited 8.75% preference shares. Derrimon Trading Company Limited was the volume leader with over 13 million units, followed by Wigton Wind Farm Limited ordinary shares with 7.8 million units and Sagicor Select Funds Limited Financial with over 1.6 million units. Now for the foreign exchange. The US dollar on Monday, March 8 ended trading at $148.96. The Canadian dollar sold for an average $119.22. The pound sterling traded for $207.94 and the euro ended trading at $181.43. Oil prices rose on Tuesday on expectations of a recovery in the global economy after U.S. Senate approval of a $1.9 trillion stimulus bill and on a likely disruption from Saudi Arabia in the United States. But a stronger dollar and receding fears of oil supply disruption from Saudi Arabia after an attack on its oil facilities capped gains. Brent crude futures rose 32 cents to $68.56 a barrel. West Texas Intermediate crude futures rose 19 cents to $65.24 a barrel. And that's it for the business report on PBCJ. I'm Gabrielle Thompson.
In news from across the region, Trinidad and Tobago is set to receive its first tranche of COVID-19 vaccines soon. The development was confirmed on Monday by Health Minister Terence Singh, who explained that the payment has been made and the shipment of Oxford AstraZeneca vaccines is likely to arrive at the end of March. More in this report from Crystal Wilson.
Minister of Health Terence Singh says Trinidad and Tobago has received a quotation from the Pan American Health Organization and has paid for its first tranche of COVID-19 vaccines under the COVAX facility. According to Minister Singh, the first tranche of the Oxford AstraZeneca totals 33,600 vaccines and comes at a cost of just over $148,000.
They gave us a quotation for 33,600 doses at a cost of $148,084.06 US. That money left the Ministry of Health on Friday afternoon. It has gone to the central bank, and between today and tomorrow, those funds will be deposited into the PAHO revolving fund.
The minister said all pros and cons were considered, and officials at the Ministry of Health thought it was best to receive part of the original 100,000 plus allocation first, instead of waiting to receive the entire batch. The vaccines are due to arrive at the end of March 2021.
We decided to go this route and not to wait for the entire shipment, because you never can tell what could happen, and an entire shipment might be delayed. So we are very happy to be receiving 33,600, and the balance of 67,000 will come, I am told, sometime in April into early May.
Minister Singh said government has also been engaged in talks with other vaccine manufacturers.
Sinopharm's dossier with their phase 3 trials, I was informed this morning, is currently before WHO. So that is good news again. It means there's a potential for a fourth WHO vaccine to become available. And as you know, we have been in talks with the Chinese embassy here since last year and Sinopharm since last year.
Crystal Wilson, TTT News.
Police in Grand Bahama are on high alert after discovering drugs packaged as popular snacks on Sunday. Barthany McDermott has the details in this report.
Police on Grand Bahama making a shocking discovery of 126 assorted name-brand snacks believed to contain THC and CBD marijuana extract at a residence on Fortune Bay Drive Sunday. Police say the search also resulted in the discovery of a quantity of cocaine, suspected marijuana, and $2,000 cash. Officer in charge of the Grand Bahama Drug Enforcement Unit, Superintendent Michael Thurston, says officers are now on high alert.
What is of serious concern to us regarding this discovery is the deceptive method of which the THC and CBD items were packaged and labeled. I wish to advise members of the public to be very careful and observant in purchasing snacks for yourselves and for your kids.
The assortment of snacks were packaged in 9 different popular snack brands, namely Ruffles, Cheetos, Fritos, Skittles, and Extreme Bites. Thurston sending a warning to members of the public to be cautious when purchasing snacks. Here's how you can tell the difference between the popular snacks and a fake.
You would want to look at the package very carefully, and there is some of the packages you see THC on some of the packages. On most of these packages you have THC or CBD. And obviously you wouldn't find that on a legitimate product.
Police say a woman and a man were taken into custody in relation to this matter. Thurston added that residents should also pay close attention to the pricing.
Some of these products are going to probably for around 50 cents to $1 in the food store. If you have an individual, legitimate ones, that's the legitimate ones, and if you have somebody on the street selling you an item that costs $1 for $15 or $30, something is wrong.
Thurston was not able to say if the tainted products were being sold in local stores, and while he admits that these drug-infused snacks are for a specific market, the danger lies in the products slipping into the wrong hands. Thurston sending a stern warning to anyone involved in the drug business.
This type of deceptive method in which persons try to get individuals to take marijuana, use marijuana, I call it a deceptive method, will not be tolerated.
Reporting for Our News, I'm Barthany McDermott.
In Barbados, the government is expected to spend some $109 million in the upcoming national budget to fight the COVID-19 pandemic. More from Barbados today.
Minister in the Ministry of Finance, Ralford, provided a sneak peek into the estimates of revenue and expenditure for the 2021-2022 fiscal year that will be laid in Parliament today. Minister Strong tells Barbados today the sum forms part of projected current spending of $3.1 billion and overall expenditure of $3.3 billion for the next financial year, beginning April 1st.
We are currently projecting total revenue of about $2.5 billion, which is slightly above what we anticipate will come in this year. And what you would anticipate would happen, as the team has been going through, is we have a situation right now, for example, where because of the lockdown in February, you will realize that the customs was only clearing essential items during that period of time. Yeah. So there's currently some items that are still to be released. So and therefore there's going to be a little backlog in terms of what was trickled into April. So that's part of the reason. So our revenue is slightly above what we anticipate we will pull in this year, at $2.5 billion. But of course, all of this is predicated obviously on ensuring that we don't have to lock down again.
Strawn says overall, government's estimates will reflect not only the unprecedented circumstances of the pandemic, but also the administration's intent to carry out its capital works program in a bid to jumpstart the economy.
We've been able to identify directly within the context of the budget for this year, just about $109 million specifically related to COVID.
Right.
That will be there. But of course, there are some programs within government where the goods and supplies and services will have been increased. But these are specifically to respond to COVID this year. And these are our best assumptions, obviously, given the experience that we've had now. Of course, we are hoping that and we've seen the results, but obviously, the spike that we had in January, we hope we don't have anything like that, because that requires a lot of resources.
In sports, we begin with athletics. Kingston College's Ralford Mullings threw a personal best of 63.69 meters over the weekend to add to his world under-20 lead in the men's discus throw. He was competing at the Class 1 event at the Jamaica Athletics Administrative Association qualifying trials, 2.8 at Excelsior High School on Saturday. 3 men went over 60 meters. Both male and female throwers performed credibly, with a litany of outstanding performances, with Jamaicans filling out the top 4 in the World Athletics Men's Under-20 Discus rankings as of Saturday. And that's the news. Thanks so much for making it PBCJ. Remember, we are the People's Station.